Right, joining us now, Aditi Hazra, Associate Epidemiologist at Brigham and Women's Hospital. For our viewers watching tonight's show, Dr. Hazra, can you explain to us what genome sequencing is? Because again, at the core of what is happening is information, and a lot of people get confused as to what really this is. And why is this very, very important with regard to the virus that causes COVID-19?
Thank you. Thank you for the opportunity. It's good to be with you. Genome sequencing allows us to look at all the 30,000 pairs of letters that make up the virus's sequence. As the virus spreads, it can mutate. Most mutations are not harmful, but some variant strains arise, and these variants can have a mutation in a critical region of the spike protein of the virus that can make it more transmissible, that can make it evade treatment and impact vaccines. But what we know is, as was just said by Dr. Reddy, the vaccine is effective. It is a shot of hope and a shot of science. We need the vaccines, and with the vaccines, the variants can be defeated. But what sequencing allows us to do is to track it, to say where is it spreading, how to identify new variants, and then we can control those specific areas. And we can also have clinical sampling to allow us to know how, if it's affecting a certain age group, people with a certain comorbidity, or certain symptoms are more severe. So that is the importance of genome sequencing, to better track, identify, and control the variants.
Aditi ji, this is Amitabh Bachchan. Thank you so much for joining us and giving us all the inputs. I have to admit that I'm not so knowledgeable or intelligent enough to know what genome sequencing is. And of course, that is something that I hope to learn after this program. But how can we tell this to a common man? Because we know, and that you believe also, that this kind of genome sequencing or viral surveillance is something you're already looking into, and you want to scale it up in India through your volunteer group called India COVID SOS. How will this work? How will you be able to explain to people? How will you explain to the common man what this means?
Thank you, Amit-ji. It's such an honor, sir, to be with you. I would first say that the health of each of us depends on the health of all of us. And what genome sequencing is it tells us a story about the virus. The virus is made up of letters, and it has a spelling error that makes it more contagious. So we need to know, where is it more contagious? You have a grandchild. I have a niece. They are too young to be vaccinated at this time. So we need to protect them by understanding the variant, which one is spreading faster, and how we can control it. So that is why we need to do the genome sequencing, to track, identify new variants, to understand the behavior of the variant, and if it's affecting certain ages or certain populations more, and then we can control it. If it's in one part of the country, if it's in a rural part of the country, then we can implement or bring resources to that region. And what we know is that majority of the sequencing has been done in the cities. My goal is to help scale rural surveillance and to have more representative sampling throughout the country. It is just like getting a diagnostic test. Then that sample is sent for sequencing. So the diagnostic test tells you if the virus is there. The sequencing tells you the entire storybook of the virus. And one page is mutated or ripped out. So that is what we are trying to fix. Let's say we're running a race. You want to know which one is running faster. So that's what I would say. We are trying to catch the one that is running the fastest.
Thank you very much, Ms. Hazra.